to be well with your health. I'm Shanna.
And I'm Nimeet.
Welcome to the 50th episode of the Adventist HealthCare and Moo podcast. Today, we are coming to you from the 75th Annual Montgomery County Fair. We are actually recording live from the first aid booth sponsored by the Adventist HealthCare Shady Grove Medical Center. Nimeet, I saw a picture of you in there.
I saw a picture of myself as well.
Does this feel like, it feels like deja
home.
vu,
it feels
feels like
deja
home?
vu. Yeah.
Perfect.
I'm so excited. I can't believe it's 50 episodes.
I know.
That's insane.
I know. We have some fairly exciting activities for our 50th episode, but before we dive in, I have to ask you, what is your favorite part of the fair now?
Oh my God. Growing up, there used to be a fair right next to my school, and it was in a school ground.
Oh.
And it was like the best thing ever.
I need to go to that school.
I know. And, the rides, the food, the games, everything about it. I love it.
I love coming out here every year to the fair. Shady Grove Medical Center is a sponsor here at the fair, sponsors the first aid. I love coming out and seeing everybody and just being a part of the community. It's such a fun thing. But my absolute favorite, I guess, if it wouldn't get me in trouble, is the food.
Yeah.
Give me a funnel cake any day. That is my favorite. Well, we are very excited to welcome a special guest today while we're here at the Montgomery County Fair. Let's kick off this episode by welcoming our first guest, Dan Cochran, president of Adventist HealthCare Shady Grove Medical Center. Welcome, Dan.
Thank you. Thanks for having me.
We're happy to have you out here. You have served as the president of Shady Grove Medical Center since 2019, and you've been a part of Shady Grove since 2011. Is that right?
2011, yes.
Yep. So you are a longtime family member here at Adventist HealthCare. Yep. We're happy to have you here on the podcast.
Thank you. Pleasure to be here.
Well, since we're at the fair, let's start by talking about the hospital's tradition of offering first aid here at the Montgomery County Fair and why that's been such an important part of Shady Grove's commitment to the community and history.
Since 1979, when the hospital was first built, we've been involved in the fair here in Montgomery County. So our nurses have come here every year since then to provide first aid in the first aid building here at the fair. And there's really a lot of reasons we like doing that. One is we are a community hospital and we want to be part of the community and out in the community and get to know people other than when they have to come to a hospital for some serious event. So it's really a great way to get to know people and for them to get to know us and what we do. As a community hospital, we get to see a lot of people in a lot of different venues, but it's really nice to see people when they're out enjoying themselves, especially on a beautiful day like today.
Yep, I love that you come out here and you interact and you see the people that we treat. And coming to the hospital is a small part of their day and of their lives. And us being here brings us into their lives even more. So it's really special that we do that.
And of course, in Montgomery County, this fair really celebrates the agricultural history of Montgomery County, which is significant for the community that we live in and still part of the community. There are still many active farms around the community. It's a very diverse community, and obviously the population very different depending which part of the county you're in. Much of our county is still agriculture, and we get to take advantage of that in many ways, from local farms that provide produce to our employees to the fair here itself. So it's really a great way to be part of the community.
The fact that you said, Dan, that, getting to know your community a little bit better, having a diverse population, been doing this for over 40 years, serving the community. And I think people are trying to have fun here, but also reminding them, hey, healthcare is also a priority and being there to support them. So, people are having fun here in the heat. Maybe they're getting dehydrated, or they just may want to just sit down for a second. It's just a nice place for our community to be there.
Dan, you've been, as I said, you've been part of Shady Grove Medical Center and Adventist HealthCare since 2011. Tell us a little bit about yourself and how you came to be here and the president of Shady Grove.
Sure. So while I've been here since 2011, my career in healthcare started a long time ago. I actually started working in healthcare in 1979. I worked as a nursing assistant and worked on the night shift, and that's how I was able to go to college. I went to college during the day, worked full-time at night as a nursing assistant. And then I went from that role to working in a business office in a hospital. So I've been in healthcare since 1979 and worked through a variety of roles and worked my way into a finance leadership role. And in 2011, came here to Shady Grove Medical Center to be the chief financial officer. Shortly thereafter, I started on with responsibilities as the chief operating officer, and then 5 years ago became president of the hospital.
Wow, it's quite a journey, Dan.
I know.
What do you like most about your job?
Well, there's a lot of really nice things about my job, not least of which are the great people I get to work with.
Yeah.
It's just an amazing group of people, from the leaders, physicians, the nursing teams, the caregivers, support staff. It's just really a wonderful team to work with of individuals that have the same mission, that really want to drive supporting our community, taking care of our community in a faith-based organization that really provides the community with the type of care that our community deserves.
Dan, the Shady Grove Medical Center is out here providing first aid at the fair, but there's a lot of other ways Shady Grove serves the community. What are some other ways that the caregivers and Shady Grove Medical Center supports the community in Montgomery County?
Well, you could look at the service that are performed at the hospital every day, and clearly those are community services, what our teams do every day. But beyond the walls of the hospital, we're involved in many different organizations, and several area organizations like the Mercy Health Clinic, Sunflower Bakery, Rebuilding Together, Casa de Maryland, Manna Food Center, and many, many others that we help support. And it's important for us to support organizations whose work promotes health equity and wellness in our community. Mm-hmm. And really it all revolves around making sure we're taking care of our community.
Yep, and those types of organizations, it's not healthcare, like physical healthcare, but it ensures that people receive the things that help them be healthy and live healthier. So that's a great thing that Shady Grove Medical Center and Adventist HealthCare support.
Yeah, and Shady Grove Medical Center, has been around for over 40 years, over 43 years at this point. What are some of the major changes or service lines that were added to meet the county's needs?
Some listeners may have noticed a large batch of construction happening around Medical Center Drive. Tell us what's going on.
Sure. So there is some large things going on right at the moment. But before we get to that, we'll go back a little bit in terms of historically how the hospital has grown, and it's really grown with Montgomery County. And as you look at Montgomery County, in 1979, when the hospital was built, Montgomery County had about 500,000 people living in it. Today, it's well over 1 million people.
Oh, wow.
And like the county, we've grown significantly. When we opened our doors in 1979, we opened with 41 active beds, staffed active beds. Since then, we're about 400 beds, so significant growth in the hospital as well. But as you look through the years, some of the major additions that have occurred over the years, in 1981, we opened up our maternity ward. So that's when we first started having babies there at the Shady Grove Medical Center. And since then, there have been tens of thousands of babies born at Shady Grove Medical Center. And that's one of the things, even coming to an event like the fair here, you get to hear from people that have had their children at Shady Grove, that were children born at Shady Grove. So hearing from those people, their history with our hospital is really just a neat thing to hear. So, and it's one of our biggest services that we have in our neonatal intensive care services.
We love our Shady Grove babies.
Yes.
I have a Shady Grove baby myself.
So do I.
Yep.
So beyond that, then in 2006, we expanded beyond our campus, opening the Germantown Emergency Center, which allowed us to, beyond the walls of the hospital, get to a point of providing emergency services up county, where at that point there were no other services. So really expanding out. And our emergency services have really grown as well over the years. We're the county's busiest emergency service provider. We provide at our Germantown Emergency Center that I just mentioned, a freestanding emergency department. We also provide an adult emergency department within the hospital and a pediatric emergency department within our hospital. And the three of those combined provide about 85,000 visits a year. So very busy emergency service and a wide variety of services that are provided to the very highest critical care services, including things like heart attacks and strokes, both of which our hospital has been recognized as being a premier provider of high quality services.
Mm-hmm.
That's great. I think those are great achievements over the past few decades.
Yeah.
And Shanna mentioned some construction happening around Shady Grove Medical Center.
Talk to us about that.
Sure. So the hospital has expanded a few times over the years. In 2009, we did a tower addition and expanded our surgical services. We also expanded at that point, our mother-baby services. So a lot happened back then, but right now, the building project is really to expand our critical care services and align those higher acuity services together. So the tower we're building has several stories. The The first ground level is adjacent to our surgical services, and that's where our cath labs, or the area where we do take care of heart attack patients and stroke patients. Those types of things are taken care of in that level, which is right below our new emergency department.
Yep.
So the primary function of this new tower, the base floor, will be a new emergency department, which will provide for all private rooms within the emergency department, as well as an expansion of services and care for behavioral health individuals coming in for those types of services as well. So it's really expanding a number of services and allowing us to provide them in a way that we need to in today's environment, both from a quality perspective, but also from a safety and from a HIPAA or privacy perspective.
And having the emergency department and something like your cath lab where you take care of heart attack patients and stroke, having them close together is so important when every second matters.
Absolutely. The time of the essence. You
Yep.
have to get testing done right away. You have to get treated right away. So having those close proximity really
Yep.
helps. Having private rooms for patients is absolutely
even better.
huge as well.
Yep.
I'm
Yep.
sure that is, a big patient satisfier as well.
Yep.
Absolutely. So we're looking forward to that. And then, of course, that building is a tower, so there's more than just those two floors.
Oh, absolutely.
Above the emergency department is a new intensive care unit that is built for today's environment. And today's environment includes an enormous amount of equipment that is used within those rooms for the patients that require that level of care. So the rooms will be about 50% larger than the ICU rooms we have today, which will allow for that equipment. But it will also allow us to take care of the patients' families better as well. We'll have a family lounge there. We'll also have a rooftop garden on the emergency department because that footprint is larger than the tower that goes up, which will allow every room in the ICU to look out over that rooftop garden, as well as a family lounge that will allow a patio area so family members can gain a little respite while they're with their family members, but to be able to go outside, get fresh air, and then back in with their family member.
Really
in the ICU.
promoting a spirit of healing. I love what Adventist HealthCare has done over the years, starting with the new White Oak Medical Center and now the new tower here at Shady Grove Medical Center, is really creating a space that's not like a typical, what you would think is like sterile walls, but how you're describing it sounds like a place of healing.
It is absolutely designed to be a healing environment.
Yes.
And since we're building it when we've been able to learn a lot of what came out of the pandemic.
Yes.
And build things so that we would be able to be flexible with whatever may come our way next. So our floors above the ICU is in a progressive care unit that allows us, it's typically a step-down unit from the ICU, but that unit will also allow us to transition those beds to intensive care if we need to. So they're built with that in mind. All the hookups, everything will be there so that it's very easy to convert those beds to intensive care if that's needed.
Yep, that's one of the things out of COVID. We learned a lot and we're taking it and building something better. All right, well, you've told us a lot about Shady Grove. We really appreciate it. How can our listeners in the community learn more about the new tower being built and the services?
Thanks for asking that question. Part of the way that we're able to do a project like the new tower at Shady Grove Medical Center is with gifts from the community. Our community has really helped us along the way through generous philanthropy that allows us to build this project and to make sure we've got the equipment and things in it that we need to provide the level of care. So if you want to just follow along on the construction, or if you want to know how to give and support the project, you can go to AdventistSGMC.com/nextlevel. See pictures about what's happening right now in the project, as well as the opportunity to give.
All right, Dan, well, we don't want to keep you any longer. We appreciate you coming out here. I know you've been out here since this morning for Senior Day, so we're going to let you go. We so appreciate you stopping by the podcast. We hope you'll come back. We want to get more updates about the tower.
Thank you so much, and I look forward to that.
Thank you.
We have another guest on our podcast who I would like to welcome. Her name is Leslie Brown. She's the Director for Emergency Department at Adventist HealthCare Shady Grove Medical Center. Welcome to the Adventist HealthCare You podcast, Leslie.
Thank you for having me.
Thank you.
Leslie's going to help us answer a lot of the questions from our community. We're excited to have her. She has a lot of insight. So let's just dive in to ask some of these community questions that we have.
Sure.
Hi, my name is Sonia. I'm from Crofton, Maryland, and my health question is, when do the nurses and staff know when an emergency C-section is needed?
So the emergency department is very prepared for anything that comes through our doors, and that's exactly what we are there for, is to see the community members that come in, identify where they need to go, and if it is a really significant emergency that we have to move them to some specialty area. We have heart attack patients, we have stroke patients, and our goal is to really see them, evaluate them as quickly as possible, and move them on within minutes. And the same thing with our maternity patients or our pregnant moms is they come in any sort of distress or they're having trouble in any way. We want to just identify that, what's happening with them, and move them on as quickly as possible to the team that will serve them best. So we have our great Shady Grove Medical Center birthing area, and we would want to stabilize that patient as best we can and then get them upstairs as quickly as possible so the people that know them best will help them. We did just do some training in the emergency department across the emergency services, our physicians and our nurses, and we were awarded the Patient Safety Center Birth Equity designation. So we're really proud of that. Our team had to go through some extensive training to earn that designation, and that's just really to help with our initiative, identifying people quickly, making sure that we know any disparities, what's happening, and we can move them on.
One of the things I love about the emergency services is that you have to be an expert on everything, right? And you have to consult with those experts as well to ensure you're providing that excellent care to our patients. It's the first line of defense for our hospitals as well, so you're getting patients from everywhere coming into the ED, and you're helping navigate, which services do they need, whether they need, birthing services, whether they need stroke workup or cardiac workup. So the emergency nurses and staff and doctors are really excellent in improvising and calling the experts as needed for their patients.
Yeah. So it's really great to hear that Shady Grove is taking that extra step to protect moms, especially in women of color where complications can happen more often. And that little extra step really helps to serve the needs of our community.
And I think the question even asked about how do we identify who would get a C-section? And that wouldn't really be up to us. That would be up to that team that's going to receive. But, they would be looking for a mom who's in trouble that could be, in some life-threatening situation, or the baby's in trouble from monitoring. We would know.
Yep, and you all have taken that extra step, so that's good.
Yes.
All right. I guess we do have another. This is great. Being live at the fair, we can take all sorts of community questions right here, so we have another one.
Hello, my name is Jessica Bland, and I'm from Rockville, Maryland. And my health question is, as the mother of a child going into college, what are the 3 most common conditions that students pick up in the dorms, and how can they prevent catching them?
Ooh, excellent one.
What a great question, and we're going back to school.
Yeah.
So, colds and flu for sure, COVID, and we are seeing a bump in COVID in Montgomery County right now. We have some patients that have been admitted to our hospital with COVID. So that's still making its way around. Any respiratory diseases, even RSV, which you usually see in really younger children, you can see that in older patients as well. And meningitis is probably the most scary.
Oh.
So if a college student came down with symptoms that were like flu-like symptoms, we would want them to be evaluated pretty quickly at an emergency department or by their physician, just so we can intervene as fast as possible, because that's probably the worst. There is a vaccine for meningitis, which is really good. There's a vaccine for COVID, and there's a vaccine for flu. So I would really ask that people vaccinate, and good hand washing, and making sure that you're just keeping a little bit of a distance between other people.
That the hand washing it's such an easy one, and
it's
we
a
just
basic
don't.
element,
I know it's
yeah.
a basic thing, and we don't always think about it, especially when you go off to college and the kids are doing their own thing.
Yes.
So that's as basic as that is. Keeping your hand hygiene, staying separate if you're sick, or just not sharing so much space.
Yeah. And if you're like any of my family members, if you don't know your vaccination status, talk to your provider.
Yeah.
Ensure that, you could get checked out with them before going to school or before going to college. Just ensure that you get a checkup before that. I think that's going to be helpful as well. If you're not sure if you're eligible for the flu vaccine or COVID vaccine, I'm sure they could guide you accordingly, right?
Yes, absolutely.
And I know when they're off kind of doing their own thing at college, my son's only 9, so I'm not there yet, but I worry anyways. But subtly reminding them that good food, green food is a good thing, and will help them continue to stay healthy while they're away.
Yes, absolutely.
All right. We have another question from a community member.
Okay, hi, my name is Nick. I'm from Silver Spring, Maryland, and my health question is, what are some of the health consequences of consistently staying up late and sleeping at a late hour?
Poor sleep habits. Probably asking the wrong person.
I was going to say, you serve in the ED.
Maybe.
That one's probably a difficult one.
Sleep is such an important part of our life, and it really just helps our bodies re-energize and regroup and fight illnesses. That at sleep time is when our bodies are allowed to really recover. So especially if somebody might be fighting something, an illness that they don't even know yet, like a cold could be coming on, that just gives our body that time to fight and do the things when you're sleeping and you're not using that energy. And it can take that energy and put it towards other things while your brain and everything else is sleeping. So getting that sleep is super important just in our diets. I have learned just through reading and things how it can affect your weight. If you're not getting a lot of rest, you can gain weight. You eat differently. You crave carbohydrates and things that we probably shouldn't be having. And then, again, just keeping yourself healthy. And it's all about that work-life balance or mind balance.
Yep. Is there a recommended amount of sleep we should be trying to achieve?
I think 7 to 8 hours is the recommended time. I do really well on 6 hours, so I find that I can't really sleep more than 6 hours, and that's what I
that works
use
for you
to get through my day. I know that my daughter puts my grandkids to bed really early, and they get like 10 or 12 hours.
Yeah, everybody's different. Their body might need maybe a little less than the 7 to 8 or a little bit more.
Yeah.
So it just depends.
Depends on where you are. And
I believe the American Academy of Sleep Medicine also recommends 7 to 8 hours.
7.
Yeah,
somewhere in there. Okay. I think we have another question.
Hi, my name is Josefa. My question is, I suffer stomachache constantly, so I would like to ask, what can I do to make it better, to resolve this pain? Thank you.
So if you're having issues, you definitely want to see your primary care doctor. Make sure you go to be checked out. There can always be other things going on. So if it's something that you notice is regularly happening to you, or when you're eating certain things, you want to make sure that you're mindful of that. Just in general preventive maintenance, we want to make sure that we are eating lots of fruit and vegetables, because that just keeps things moving along and really promotes health. It goes along with sleep, actually, and promoting our mind-body health. That, it just making sure that we're getting our fruits and our vegetables in our body, and colonoscopies at age 45.
Yes.
So that's the recommended, to start having your colonoscopies, because it's all about being preventative. But again, if you're having other issues, then you would definitely want to see your physician. If you see something that really upsets your stomach when you eat it, then you should probably try to avoid that if you can. Other than that, just take care.
Stay in tune and talk to your primary care doctor.
Yeah,
for
I like
sure.
how the community is asking about sleep hygiene and gut hygiene. I feel like they go on the back burners many of the times.
Yeah.
So I think as you said, the idea behind gut health is make sure you pay attention to your bowels, make sure your diet is well balanced, And if you see something, say something. You know, act upon it, whether you talk to your primary care provider, adjust your diet accordingly, or consult with a dietitian if you have one that you normally work with.
If something doesn't feel right, maybe it's not.
Yeah.
Get it checked out. All right. I think we have another question.
Hi, my name is Amanda, and I'm from Columbia, Maryland. And my health question is, on a hot day like this at the fair, how can we tell for signs of dehydration in people so that we can help people out when they need it?
It is nice today, but
It is nice today.
It's been hot.
Yeah.
It's been hot, though.
Yes.
Yeah.
That has been, this summer's been the hottest summer that I can really remember, I think, in a long, long time. So when you're outside, you definitely want to be taking in plenty of water. Try to get in the shade and cool your body temperature off. If you're with somebody and they're just not feeling well, they're really flushed red, or maybe even pale, their skin's going to be really, really hot. And sometimes they'll be sweating, but I think we get most concerned when the sweating stops and they're dry, and then their heart starts to race, they become tachycardic, and they could be dizzy, there can be confusion, nausea, vomiting. We would definitely want to be seeking first aid at our booth here at the fair, or calling 911 if you're somewhere else.
I think it's so valuable having this at the fair because it's so hot around. People are not thinking about it typically, and it's so hot. And I also like the fact that he said hold each other accountable. So, you may be feeling okay, but your loved one may not. Paying attention to their sweating, or, ensuring they just look okay. And if they look off, maybe it's time to, relax or go into the shade or just have some water.
Yeah. Even, we talked about the kids going back to school. Yeah. They'll start playing in their practices and their games. And even though it's, becoming later in the summer season, it's still really hot out, and you got to keep an eye on those kids too.
Yes, for sure.
So, all right. Well, thank you for those excellent answers, Leslie. We appreciate your time here. I know how many years have you been helping out at the fair?
So this is probably my third year.
Okay.
I worked for Adventist for 6 years now, and I did it on the first year, and then last year and this year.
Okay. Well, we are happy to have you out here. It's such a pleasure to be able to serve the community in this way.
Thank you. I feel the same way.
Yeah, and we just appreciate all that you do. I know the emergency department is not easy, and we appreciate everything that you do.
Thank you. I
Thank
appreciate
you.
that very much. Thank you all.
So we are going to do a little history recap of the podcast since this is the 50th episode. And I'm excited to welcome one of our producers, Joel. He's going to give us some questions to answer.
I'm nervous.
So Joel, officially on recording, welcome.
Thank you very much. I'm happy to be here. I'm happy to celebrate the 50th episode with you all.
Me too.
And for everybody listening, Joel's always there behind the scenes.
Yes.
So it's
Me
nice
and my wonderful team.
Yes.
Yeah.
Yes.
Yeah,
All right.
All right. So our first question that we have for you all is, what has been your favorite episode overall and since episode 25?
I knew you were going to ask me that, and I was not prepared for it. I think I don't have a favorite episode, but I just have favorite themes.
Yeah.
I think we cover so much on the mental health aspect of it. I think the work-life balance. I know we invited our employee assistant program group just to talk about work-life balance and what to do, how to navigate your work if you're stressed over it. Turning 26, I believe that was after our 25th episode as well, we had Carlos, who was our VP of HR, sharing some of the how to navigate 401ks and just retirement or just benefits in general. And then we also had our doctor in that call as well talk to us about how to pick a new provider because you're at that transitional or maybe changing insurances and how do we navigate that. So I think there's a lot of themes that I liked over the past many episodes. So I can't pinpoint on one episode particularly.
So I think my favorite continues to be our colorectal cancer survivor, Miss Smith. I continue to think back on that one, and she inspires me. But then I think my second best, Nimeet, you missed this one, but was our podcast with Peru. So our facility dog with rehabilitation. I'm a dog lover, and I just think the work that rehabilitation does and that the work that Peru supports is just so unique and special. So that was another one of my favorites.
Yeah, I think, I don't want to speak for all of our producers, but I will say I think that's probably one of our favorite episodes as well.
Yeah, maybe we need to have a dog or something every episode.
I agree.
Something special. All right, our next question is, what's one surprising thing you've learned from the different guests who have appeared on the podcast?
Can I answer that one first?
Yeah, go ahead.
Building on what you say when you were talking about all the different guests we've had and the different topics, even though I've been here for almost 11 years, I continue to be inspired and impressed with the amount of expertise we have across Adventist HealthCare among our physicians, our different providers, and even our leaders that we've had on and our different types of experts. And so I continue to want to bring different experts and showcase and highlight the really special things that we have here at Adventist HealthCare.
You know, one of the surprising things to me was about our cancer service line. I know one of our speakers mentioned having a one-stop shop through our cancer services, whether it be getting images done or getting treatment done or just setting appointments. Having all that in one place is so valuable. And, we don't make it easy to get appointments. Healthcare doesn't make it easy to get appointments for our patients. So I think having that in one of the service lines is so helpful for our patients in our community. And I think that's just the beginning of a lot of the other work we'll be doing in the future as well.
Yeah, absolutely. I think it's so important that we highlight all of our specialties here on, on the podcast and really bring attention to a lot of the service lines that we support. So our next question is, what are you most looking forward to for future episodes?
We did that series on mental health where we did about 5 parts, different ones. And I thought that was wonderful. So I continue to want to look at ways to bring the mental health aspect into our everyday and continue to highlight the patient stories and the wonderful care done at Adventist HealthCare in a lot of different ways. And we want to hear more from our listeners, right? We want to tell the stories and give you the information that you all want.
Yeah, and I think I just want to continue this journey, right? Each speaker has their own tips and tricks, and these are from the subject matter experts. I think there's so much information out there. It's so hard to navigate what is real information, what is not. And I think just from our speakers, having those tidbits from them, it's just so helpful.
Absolutely. Well, now that we have made it to our 50th episode, is there anything else you all would like to mention?
I would like to give a shout out to our producer, Joel, our other producers, Megan and Allison. They really make this happen. They make it sound good. They make us, I was going to say look good, but nobody can see us.
They still make us look good in a way.
They do that too. Yes. But they really put their heart and soul in making this podcast sound good, coming up with ideas and bringing forth really great experts. So I want to give them a shout out.
I completely agree. I think Shanna, you and I probably have the easiest job here, and you guys make it easy for us. So I really do appreciate that.
We appreciate you all.
Well, we love doing it, and it's a great time. It's a great time for everybody.
And I'm looking forward to actually bringing this podcast on the road a bit more. This has been fun coming out to the fair.
And people are interested.
I know. People are stopping. I think it looks official.
All right. Well, thank you all for answering those questions, and congratulations on the 50th episode.
Thank you.
Thank you.
All right.
I just want to thank everyone who joined us for our 50th episode today, making it so special. We had our fair share of learning about the latest updates from Shady Grove Medical Center and interacting with the community and answering all their health questions.
The puns keep coming.
To learn more about the expansion occurring at Shady Grove Medical Center and their new tower, visit AdventistSGMC.com/nextlevel. To find more information about your health and our experts, visit AdventistHealthCare.com. We would also love to hear from you, so let us know if you like the podcast by leaving a rating or a review, or can email us at podcast@AdventistHealthCare.com and let us know what healthcare topics you want to know more about. Don't forget to subscribe to the podcast so you can get new episodes. Thank you and be well.